Welcome to Professor Speaks. My name is Alex Hernandez. This is Dr. Craig Stern. Sorry we've been away for a while. We've been traveling, and I hope you checked out our last week's episode that involved women's health and involved a couple of our colleagues. And please be sure to go check it out on Facebook or Twitter or YouTube. I believe it's YouTube, right? Yeah, YouTube. And the topic we're going to discuss today is the BCRA. It's the Senate bill that was brought up to replace Obamacare. That's what it's used for. And so Senator Mitch McConnell decided next week he was going to delay the vote till next week. So it gives us time to kind of go over some of the specifics. We won't go into too much detail here because we won't have the time to. But we want to cover some important topics that might be misleading to the public. Like our first question, which is the ACA really failing? And I'm going to leave that to you, Dr. Stern.
Sure. Alex, I agree with you. I think that there's a problem here. And I want to stay out of politics because there's so much argument going on. Most of it is false. And I think it's important that we ask assumptions. So what we're going to try and do is stay away from politics and deal with what are the assumptions that are being done here, and are those assumptions correct or not? Whether you're Republican, Democrat, or otherwise, healthcare affects literally everybody in the United States. It affects 1/6 of the economy, at minimum 1/6 of the entire population. So we need to take all this political mumbo jumbo out of it and talk about what really are facts and not this nonsense about alternative facts and everything else, which is silly, and we cannot make medical decisions based on people who don't tell the truth. So issue number one is the ACA a failure? And the answer is no, it's not. The argument has been made that it's a failure because there are about 1,000 counties in the United States for which there's only one member health plan of the healthcare exchange. That is a problem. It's a huge problem and clearly needs to be addressed, and we'll talk about it in some of these questions.
Right.
The real problem is what's happened to the healthcare system. The healthcare system is that, one, there has been about a 36% increase in people who are covered, especially across all of the healthcare budget guidelines, 134% of the federal poverty level, 150%, etc. It's all above 30%. So there's been improvement in that. There has been a significant improvement in all of those states that expanded Medicaid, because at its most basic, this is really an argument about whether there's going to be an expansion of Medicaid or whether they're not. And a lot of people don't like the idea that there's going to be more government control, more government money spent on Medicaid type programs, and we'll talk about that as well. But there has been an expansion in that, and all of those states that have dealt with it have seen an improvement. They've seen a decrease in cost of hospital costs. It went from about 7% of total hospital costs for states that didn't get involved in Medicaid expansion. Those that did get involved, it went to about 2%. There's a host of information. There's been a lot of information that's identified it. So depending on the indicators, if the only issue that you're looking at is the number of exchanges, then yes, there's a problem, and it's a problem that needs to be solved one way or the other. If it's an issue about whether there's been an improvement in healthcare, then yes, and we've had at least 12 million people and more that have signed up that have gotten health care, and then a significant improvement in what went on. So just this constant rhetoric about that it's failed is just total nonsense.
I'm sure a lot of people would agree. But another issue that is often brought up by the Republican side, I know we want to avoid politics, but one significant issue that the Republicans have brought up was that it resolves this issue of access. And I'm sure a lot of people at home don't really understand what that means fully. If you can define it for us.
Yeah. Once again, we're dealing with assumptions. Access means that you have access to insurance, that you have access to providers, and that effectively you can afford it. People have access today. there's probably about a third of the people who can't afford it, so they don't have access, and there's at least 2/3 of the people who do. So
Right.
just to keep it fair, about 2/3 have access, everybody has access, about 2/3 of them can afford it, about a third of them can't. So it requires some financial issues, no matter what is done, in order to ensure that that third of the people have a chance to deal with it. The second problem with the assumption is that if you remove all of the exchanges, you move it to an open system, you lower the cost, then people have the opportunity to buy insurance if they wish and to buy it at a lower cost. The reality of this is that before the Affordable Care Act, people did not buy insurance. Under the Affordable Care Act, people were forced to buy insurance, and there was a taxable penalty that they had to pay in their taxes if they didn't.
Right.
Well, without doubt, under the Affordable Care Act, the penalty that was placed in it was too low.
Right.
It needed to be higher. The goal being that there was a guaranteed access, meaning that everybody would be included, with the idea being that if everybody is included, everybody's paying in, and then a smaller percentage of people are taking out. Well, if everybody isn't in, then only the people who are sick and have problems are going to take money out,
Right.
and clearly their cost is going to go up under any system, whether it's the Affordable Care Act or the American Health Care Act or any other acronym that you put to this. The reality of it is costs will go up. Furthermore, the demographics of the population is moving to the baby boomers, who are all flooding into the system where they're going to need care. Mm-hmm. And there's a significant increase in cost that's going on, whether it's in new procedures, certainly in specialty drugs that are being given not just for orphan diseases, but now for chronic diseases that cost in many cases 100 to 1,000% more than the current drugs. So we're dealing with a world where the costs are going up one way or the other. And then finally, in this issue of access is the argument of, well, we don't want government involved in the system. We want to make sure that the federal government is moved to the state governments, and the state governments can cover what is going on rather than the federal government having to pay for it. Right. The reality of it is that somewhere around 58 million people are in Medicare. Another 55 or 58 million are tied up, or 55 million in Medicare, about 58 million in Medicaid. The government's already involved. We're dealing with over 100 million people out of a 400 million population.
Hello again. Sorry about that. We had a little technical difficulties, but we're just going to move right along and go on with our topic about the Better Care Reconciliation Act. And the next question I wanted to get to was, is there a rationale for creating a bill designed to cover less people? The CBO has already predicted or projected that about 20 some odd million people will lose coverage within the next 2 to 3 years, I believe it was.
The problem that we have here is, once again, an assumption in what's going on. The assumption is that we're going to give a bill, we're going to move care from payment by federal to payment by state, mm-hmm. that there's going to be a contraction in the Medicaid program, and the states will have to deal with the contraction in the Medicaid program, right. That the payment for the Medicaid program is going to be hampered because they're going to remove $800 million from the federal money, mm-hmm. that will have to be handled by the state. And then finally is this issue that you gave people something and now you're going to take it away. Historically, when you give people something, whether it's an entitlement like Medicare, Social Security, or whatever, you don't take it away. Right. Medicare has been changed 11 times. The Medicare Part D was changed, I don't know exactly how many, but probably about 7 times. And the problem is that no one takes something away after it's been given. Before the Affordable Care Act, there was a good deal of argument about whether people were going to like what was going on, whether they were going to like the essential benefits, etc. But now you've given it to them.
Right.
And taking things away from somebody that has been given is not a good plan no matter what.
Right.
Finally, with the assumption here is the following, and we need to do it whether it's Affordable Care Act or the other issues, and that's this. In a world where there are sick people and people who are well, if we only deal with the sick people, then costs are going to go up no matter what. People who are poor, people who are disadvantaged, they have more because their nutrition is less, because they're not going to doctors as frequently, they're not getting procedures that they need, etc. And the pre-existing condition, which I've talked about in the past, that is really chronic care,
Right.
These things exist. They have high populations of diabetes, of hypertension, of hyperlipidemia, etc. These exist. And the therapy as well as the cost for that therapy continues to rise. So we're dealing with a population where you have to get individuals who are healthy into the population. The Affordable Care Act did it one way, said that there had to be a penalty. The penalty on the insurance then could harm people who still couldn't afford it. So one of the things you have to deal with here, no matter what you do, is to still find a way for them to be able to get insurance. Access has been there, it's there today, it'll be there tomorrow. What are you going to do about that? And in that regard, you're going to have to take a look at subsidies. The argument on subsidies has been a major issue between Republicans and Democrats over that, but you still fall down to the fundamental mathematics of the problem, and that is the law of large numbers, everybody putting money in order to pay for some who take it out. That's an insurance issue for a health plan. Doctors have issues with regard to how much does it cost to treat a patient. The average patient who doesn't have any medical problems costs about $1,600 a year. The person who has problems, depending on the number of comorbid and chronic problems, rises to upwards of $20,000 or more, and people at the end of life have a totally variable number because you don't know how many cares. Well, when you average that whole thing up, the average cost of the general patient, whether they're healthy or not, is about $8,000, which means that per person per year. So that means that the person who the doctor is treating, they still need to see more relatively healthy people versus sick people, or they can't afford to deal with it either. So it's not just an insurance problem. It's not just a government problem. It's a problem that works its way down all the way to the provider, which is one of the reasons why doctors are against it, hospitals are against it, insurance companies are against it, etc., because nobody's looking at the math, and you can't avoid dealing with the math.
Right. And when he says it, when they're doctors and providers, all of them are against it, he's talking about the BCRA, because a lot of them were not informed or even involved in the creation of this bill.
That's true.
Which is a huge problem when you're considering 1/5 of the nation's economy and 1/6 of even the population of the United States. So that pretty much sums up everything that we wanted to cover today. Please visit ProPharmaConsultants.com. We have a free information page called RxInfoX, and on there you'll find from various sources, various articles on healthcare, on specialty drugs. Please visit and like, share, and subscribe on all our videos. We have social media. We're very busy on social media when it comes to Facebook, Twitter, YouTube. I think I'm even LinkedIn. I'm even losing count of all of the social media contacts. But please visit us, like, share, subscribe, and we'll see you next week.